Today, we'll take a look at evidence-based practice. Evidence-based practice helps protect against unsafe and ineffective methods, ensuring high-quality healthcare. One common example of how we interact with evidence-based practice without even realizing it is our use of over-the-counter medications like pain relievers. When we choose to take ibuprofen or acetaminophen for headaches, we're relying on evidence-based practice. These medications have undergone extensive clinical trials to determine their safety and effectiveness for treating pain and inflammation. Additionally, when we follow the recommendations of public health guidelines such as vaccinations or preventive screenings, we're engaging in evidence-based practices. These guidelines are created based on rigorous research studies that assess the effectiveness of different interventions in preventing diseases. Even in daily habits like washing our hands to prevent illnesses, we're applying the principles of evidence-based practice. Research has consistently shown that hand washing reduces the transmission of germs, leading to healthier outcomes. Now that we've talked a little bit about how evidence-based practices shows up in our day-to-day life, let's define it. What exactly is evidence-based practice? Evidence-based practice is a thoughtful approach that combines the best available research, clinical expertise, and patient preferences to guide decision-making in healthcare and other fields. This isn't just about theories. It's about real-world impact, improving outcomes, and building trust in healthcare settings. Evidence-based practice stands on three solid pillars. First, best available evidence. Next, clinical expertise. And lastly, patient preferences. Let's break it down. The first one is the best available evidence. This includes different research types, such as quantitative and qualitative studies, systematic reviews, and meta-analysis. Each type serves a unique purpose. Quantitative research. This relies on numerical data to find relationships between variables. Quantitative research is powerful for establishing broad patterns, but sometimes it misses the nuances of individual preferences. On the other hand, we have qualitative research, and that gives us deep insights through interviews and observations and capturing the complexities of human thoughts and feelings. It's like looking at the story behind the numbers. Another aspect of best available evidence is the systematic reviews. The systematic reviews combines all existing studies on a topic to answer specific questions. When we take it a step further and combine the data from all of these studies, then we get what we know as the meta-analysis. That's the powerful tools that gives us even more robust findings. The hierarchy of evidence is a crucial consideration within this context, as it helps us judge the strength and reliability of the evidence. Generally, systematic reviews and meta-analysis sit at the top of the hierarchy, followed by randomized controlled trials, cohort studies, case control studies, and expert opinions. The hierarchy serves as a guide for researchers and practitioners to determine which sources of evidence should inform their choices and recommendations. In summary, the best available evidence framework underscores the importance of using a diverse array of research types to make informed decisions. Each approach has its own strengths and limitations, and together they provide a more comprehensive view of the subject matter at hand. Now we'll focus on the next pillar of evidence-based practice, which is clinical expertise. Clinical expertise refers to the skills and knowledge that practitioners acquire through their education, training, and the hands-on experience that they have with patients. These expertise plays a critical role in patient care as it allows practitioners to assess individual circumstances, utilize judgment, and make informed decisions tailored to each patient's unique needs. One of the key elements of clinical expertise is the practitioner's ability to weigh the nuances of a patient's situation. This includes taking into account not only the clinical symptoms that a client or patient is experiencing, but also the social, emotional, and environmental factors that may influence a patient's health. Such insight often comes from years of experience and reflects a depth of understanding that may not be fully captured in research studies. Consequently, seasoned practitioners may identify patterns or nuances that provide clues to a patient's condition, leading to more accurate diagnosis and a more effective treatment plan. Moving right into patient preferences. Incorporating the patient or client values and preferences into the treatment choices is essential for fostering a collaborative and effective healthcare environment. When clients are engaged in the decision making process, they're more likely to feel a sense of ownership of their own health and their treatment. This empowerment can significantly enhance the adherence to treatment plan and overall satisfaction with care. One of the primary reasons of including client input is that it respects their individuality. Each person brings their unique experiences, their beliefs, their preferences that can influence their treatment outcome. For example, a client may have specific preferences regarding medication types, or a treatment modality, or therapy modality, or even lifestyle changes. By understanding these values, healthcare providers can tailor interventions that align with a client's lifestyle and their needs, making the treatment more relevant and effective. Every patient situation is unique, and having experienced practitioners who can weave together research with their insight is key to effective healthcare. Bringing it all together, evidence-based practice stands on three solid pillars: best available evidence, clinical expertise, and patient preferences. All of these pillars together, they make up evidence-based practice. Now we'll take a look at some tools and resources for practitioners. Where do you go to find high quality evidence? Well, I have a few resources for you. The first one is the Cochrane Library. The Cochrane Library is a collection of databases from the Cochrane Collaboration, renowned for its high-quality systematic reviews and meta-analysis. It is primarily focused on healthcare and clinical effectiveness, offering robust evidence to inform decision-making. Next, we have the PubMed. PubMed is a free database that is maintained by the National Center for Biotechnology Information, NCBI, at the National Institutes of Health. It provides access to a vast collection of biomedical literature, including articles from reputable journals, studies, and clinical trials. With over 30 million citations, PubMed is an essential tool for researchers, healthcare professionals, and students that are seeking primary research articles and reviews. Next up, we have PsycInfo. It is a comprehensive database of psychological literature maintained by the American Psychological Association, the APA. It provides access to a wide range of resources, including journal articles, books, book chapters, dissertations, and technical reports related to psychology and related fields. This database covers various topics like psychology, psychiatry, sociology, education, and lots more. As a general rule, when we're searching for evidence-based practice, it is important that we check reliable websites such as those of universities, government departments, or reputable organizations like the ones that I've just shared. Oftentimes, those websites, they end with .gov, .org, or .edu. Please remember to always exercise caution and use your judgment when retrieving information from websites. As we wrap up our discussion today about evidence-based practice, remember that EBP is not just a concept. It is a vital practice that improves our healthcare system and enhances patient outcomes. By relying on the best available evidence and integrating it with clinical expertise and patient preferences, we ensure that care is both effective and compassionate. If you found this video helpful, please be sure to hit the like button, subscribe to the channel for more content, and share your thoughts in the comment section below. What are your experiences with evidence-based practice? We'd love to hear from you. I'll see you next time on the next video. Take care and God bless. Bye.